Hey everyone, and welcome back to the channel. Today we're diving into a topic that might sound complex but is important to understand: acoustic neuroma. Have you ever experienced a gradual hearing loss in one ear, a persistent ringing, or maybe felt a bit unsteady on your feet? While these symptoms can have many causes, they could be signs of a condition known as an acoustic neuroma, also called a vestibular schwannoma. So, what exactly is it? It's a noncancerous and usually slow-growing tumor that develops on the main nerve leading from your inner ear to your brain. This nerve, called the vestibulocochlear nerve, influences your balance and hearing. Because these tumors are benign, they don't spread to other parts of your body, but as they grow, they can press on important nerves and brain structures, leading to a range of issues. Let's talk about the symptoms, because they often start subtly and can be easy to dismiss. The most common one is gradual hearing loss in one ear. It might be so slow that you barely notice it at first. You might find yourself turning up the volume on your phone only on one side, or constantly asking people to repeat themselves. Another hallmark symptom is tinnitus, which is a ringing, buzzing, or hissing sound in the affected ear. For some, this ringing is the first thing they notice. Then there's the issue of balance. Since the nerve involved is crucial for our sense of equilibrium, you might experience unsteadiness or a feeling of being off balance, almost like you're on a boat. As the tumor grows larger, it can cause more significant problems. You might feel numbness, tingling, or even weakness in your face because the tumor can press on the facial nerve. In more advanced cases, it can lead to headaches, clumsiness, and mental confusion if it starts to press on the brain itself. So, when should you see a doctor? It's really simple. If you notice persistent one-sided hearing loss, ringing in one ear, or problems with your balance, it's time to get it checked out. Don't just assume it's a part of getting older or due to loud noise exposure. While those are possibilities, it's crucial to rule out something like an acoustic neuroma. Your primary care doctor is a great starting point. They can perform an initial exam, and, if they suspect something, will likely refer you to a specialist, such as an audiologist for a hearing test, or an ear, nose, and throat doctor, an ENT, or a neurologist. Early diagnosis is key because it gives you more treatment options and can help prevent more serious complications down the line. Don't wait and see. Your health is too important. Now, you might be wondering, what causes an acoustic neuroma? For the vast majority of people, the cause is unknown. These are called sporadic acoustic neuromas, and they just seem to happen by chance. While acoustic neuromas are benign, they can still lead to complications, especially if they are left untreated and allowed to grow. The most direct complications are related to the nerves they affect. Permanent hearing loss is a significant risk. Even with treatment, it's not always possible to preserve hearing in the affected ear. Facial numbness or weakness can also become permanent, affecting your ability to smile, blink, or make other facial expressions. Balance problems can persist, making it difficult to walk or perform daily activities. In very rare and extreme cases, a very large tumor can press on the brainstem, which controls vital functions like breathing and heart rate. This can become life-threatening. This is why monitoring and treatment are so important, to manage the tumor before it gets to a point where it can cause these severe complications. Let's move on to how an acoustic neuroma is diagnosed. It usually starts with that visit to your doctor about your symptoms. The first step is often a hearing test, called an audiogram. This test can precisely measure your hearing ability in both ears and will show if there's a loss, particularly in one ear, which is a red flag. If the hearing test is abnormal, or if your symptoms strongly suggest an acoustic neuroma, the next and most definitive step is an imaging scan. The gold standard for diagnosis is a magnetic resonance imaging, or MRI, with contrast dye. This scan creates detailed pictures of your brain and inner ear structures and can clearly show a tumor, its size, and its exact location. Sometimes a CT scan might be used, but an MRI is generally preferred because it provides a much clearer image of soft tissues like nerves and tumors. Once a diagnosis is confirmed, what are the treatment options? There isn't a one-size-fits-all answer. The best approach depends on the tumor's size, your age, your overall health, and whether your symptoms are getting worse. There are three main strategies. The first is observation, or what doctors sometimes call watchful waiting. If the tumor is very small and not causing many symptoms, your doctor might recommend just monitoring it with regular MRI scans, maybe once a year. Since these tumors often grow very slowly or sometimes not at all, immediate treatment isn't always necessary. The second option is surgery. The goal of surgery is to remove the tumor, ideally while preserving the nearby nerves, especially the facial nerve and, if possible, the hearing nerve. There are different surgical approaches, and the one your surgeon chooses will depend on the tumor's size and location. The third option is radiation therapy, specifically a type called stereotactic radiosurgery, often known by brand names like Gamma Knife. This isn't traditional radiation. It uses many tiny, highly focused beams of radiation to target the tumor from different angles. The goal isn't to remove the tumor, but to stop its growth and, in some cases, shrink it over time. It is a less invasive option than surgery and is often used for smaller tumors or for patients who may not be good candidates for surgery. Some people also explore alternative medicine or lifestyle changes to manage their condition. It's really important to state that there are no alternative therapies that have been proven to cure or shrink an acoustic neuroma. However, some complementary approaches can help manage the symptoms. For example, things like acupuncture or meditation might help some people cope with tinnitus or the stress of a diagnosis. For balance issues, vestibular rehabilitation therapy, which is a type of physical therapy, can be incredibly helpful. It involves specific exercises that help your brain and body learn to compensate for the imbalance. When it comes to lifestyle, maintaining a healthy diet and regular exercise is always good for your overall well-being and can help you feel stronger as you navigate treatment and recovery. If you do consider any alternative treatments, please always discuss them with your doctor first to make sure they are safe and won't interfere with your medical care. Your medical team should always be in the loop. Living with the symptoms of an acoustic neuroma or recovering from treatment can be a journey. There are things you can do at home to make life easier. If you have hearing loss, assistive listening devices can make a huge difference. If you're dealing with balance problems, make your home safer by removing tripping hazards like loose rugs, ensuring good lighting, and installing grab bars in the bathroom. Joining a support group, either online or in person, can also be invaluable. Connecting with others who understand exactly what you're going through can provide emotional support and practical advice that you just can't get anywhere else. Remember, it's okay to ask for help, both from your medical team and from your friends and family. This isn't something you have to go through alone. So, to wrap it all up, an acoustic neuroma is a benign tumor that can cause hearing loss, tinnitus, and balance issues. If you have these symptoms, especially on one side, see a doctor. Diagnosis is straightforward with an MRI, and treatment options range from observation to surgery and radiosurgery, tailored to your specific situation. While it can be a challenging diagnosis, there are effective ways to manage it and excellent resources to support you. Thank you so much for watching today. I hope this video has been informative and helpful. If you found value in this, please give it a thumbs up and consider subscribing to the channel for more health content. Don't forget to hit that notification bell so you won't miss our next video. Stay safe, stay informed, and we'll see you in the next one.